Good morning. This is Humberto Martinez. Many students appear to be confused about how to describe the findings in different imaging modalities in radiology. So essentially I thought, well, do you speak radiology? So hopefully this short video will help and clarify this situation. Each imaging modality has its own language, its own lingo. So let's review who they are. We have plain radiography, we have ultrasound or sonography, computed tomography, magnetic resonance imaging, and molecular imaging, better known as nuclear medicine. So, in plain radiography, which is how it all started, there are essentially 5 radiographic densities, and it depends on how one density compares to the other that we may be able to discern the edges of the anatomical structure. So we have air density, fat density, soft tissue, which is the same as water density, bone density, and of course metal. That includes foreign bodies, life support devices, and contrast. So how do we describe the findings on a chest radiograph? Well, the finding is either going to be radiolucent, which means that it's less dense than the surrounding tissues. And examples of this, of course, would be air or fat within a soft tissue density or other density that is higher in radiographic density than the air or the fat. An example would be a lytic lesion in a bone. It'll be something dark inside a bone which is more white. Or the lesion or the finding may be radiopaque, meaning that it's more dense than the surrounding tissues. And examples of that are, of course, calcifications within the soft tissues, blastic bone lesions, which are even denser than the bone itself, foreign bodies, something that enhances with intravenous contrast, but that would not be in a plain radiograph, then that would be a contrast study. So here's an example. Okay, we have a complete opacification of the right hemithorax. This is a radiopaque right hemithorax. In this particular case, it turned out to be a massive pleural effusion. Since it opacifies the entire right hemithorax, it's called a whiteout. On the other hand, on this one, the right hemithorax is radiolucent, meaning that it has less density than the surrounding tissues. In this case, it's obvious that we have a tension pneumothorax. In ultrasound, which uses no ionizing radiation as opposed to X-rays, it can evaluate the soft tissues very well, fluid collections. It can evaluate blood flow in vessels, that's called Doppler ultrasound. However, it cannot penetrate or give you good evaluation of air-containing structures like the lungs, for example. Calcium literally blocks the sound waves, and of course metal. And what happens is that the sound drops beyond that. It's called a shadow. So terminology in ultrasound. Anechoic, meaning there are absolutely no internal echoes, no noise. Examples of this would be a normal gallbladder and a simple cyst. Hypoechoic, that refers to something that has very little internal echoes, but it has some. And we can see that, of course, in different grades of complex cysts and abscesses. Echogenic, that means that it's sonographically dense, it's echogenic. It has many internal echoes, and examples of that would be when you image soft tissues or you image a big collection with blood products, a hematoma. Now you should remember shadowing is something that happens when there's no transmission of sound. It drops, the sound drops, and beyond that it's no echo. So it's calcium is an example, metal, air. Enhanced transmission, that's what happens when the ultrasound waves goes through a fluid medium and the sound echoes are enhanced beyond it. That's called increased echoes or enhanced through transmission. Examples. Here is a rounded anechoic structure with no internal echoes, and if you see, this is the skin surface, this is the lesion, and this is what happens posterior to the lesion. The sound echoes are increased. That's what's called enhanced through transmission. And you're looking at here at the perfect example of a simple cyst. On the other hand, here we have a gallbladder, which is definitely not anechoic. It has internal echoes. And we have this barrier beyond which the sound becomes attenuated or blocked. This is shadowing. So this is echogenic, this is acoustic shadowing, and this is what happens when you image a gallbladder which contains gallbladder stones. Now with computer tomography, just to remind you, there are different types. You have plain computerized tomography, doesn't use contrast at all, and that's mostly used for evaluation of the lung parenchyma, like pulmonary nodules and infiltrations in the lung parenchyma. A contrast-enhanced CT requires injection of intravenous contrast material, usually an iodine-based material, and that's used for staging of malignancies, evaluation of pleural lesions, evaluation of the mediastinum and the hyla, particularly for masses or lymphadenopathy. A CT angiogram is more than a contrast-enhanced CT. It is a targeted, timed study for the target vessel, whether it's for the pulmonary arteries, whether it is for the aorta or the coronaries. A cardiac gated CT angiogram is what's needed to evaluate the aorta and the coronaries so that we reduce cardiac motion at all costs. High resolution CT is definitely not high definition television. It is only used to evaluate the parenchyma, especially when you're looking for chronic lung disease such as pulmonary fibrosis, and it is the exam of choice for bronchiectasis. So how do we describe the findings on CT? Well, here we're dealing with increased or decreased attenuation of the X-ray. So a high attenuating lesion is hyperdense compared to the surrounding tissues, like calcium, metal, acute blood, contrast enhancement. Low attenuation is hypodense compared to the surrounding tissues, like tissue necrosis or cavitation, hypovascularity or avascularity of a lesion. Air and fat are hypodense on CT. Here's an example. This is a high attenuating or hyperdense lesion or content, which happens to be convex towards the brain, and it's associated with soft tissue swelling, and this is what you see in an acute epidural hematoma. Contrary to that, we have a relatively hypodense or low attenuating collection, which is concave, and this is seen in chronic subdural hematoma. Old blood products tend to be hypodense and low attenuating. Now with magnetic resonance imaging, which is probably the most recent kid on the block for discoveries, big discoveries in radiology, uses no ionizing radiation. It uses a strong magnetic field to produce computer images which are like tomographic sections, just like in CT. We can acquire the images in different planes, axial, sagittal, coronal. We can even do 3D reconstructions. It is excellent in the neurological system, brain, CNS, spine. Excellent for cardiovascular imaging, musculoskeletal imaging, and recently has become incredibly useful in breast imaging, particularly in breasts that are very dense. It is somewhat limited in evaluating the lung parenchyma. It doesn't have the detail that a CT of the chest does. So remember also, if the patient has had surgery or has surgically implanted devices, surgical clips, there is limitation. Some of these are not friendly with MR. So there is some limitation, and you have to be cautious with that. So how do we describe the findings on MR? Well, here we talk about intensity. So a finding is hyper intense when it has a high signal compared to the surrounding tissues. For example, fluid and edema in T2 weighted images are hyperdense or hyperintense, and contrast enhancement in the T1 weighted images. Hypointense, low signal compared to surrounding tissues. Examples are fluid and edema in T1 weighted images. So here we have a coronal reconstruction, and we have this lesion that is hyperintense, an intraaxial lesion, and it has a surrounding hypointense material, which happens to be an intraaxial lesion with a surrounding edema. Molecular imaging, better known as nuclear medicine, nuclear scintigraphy, is considered to be the most physiological and clinically oriented of the imaging specialties. Essentially, radioactive isotopes, which are called radio tracers, are injected or given orally or by inhalation, and these are delivered to the target organs. And the emanation of this radioactive material from the patient is detected and recorded by a device which is known as an Anger camera or a gamma camera. And this produces then the anatomical diagnostic image. So, how do we describe the findings in molecular imaging or nuclear medicine? Essentially, the lesion or the finding either has increased uptake, which means there's greater radiotracer accumulation in that area relative to the surrounding tissues, sometimes described as the lesion is radiotracer avid, or it may be hypermetabolic, depending on the study that's being done. Essentially, it has increased activity. Now, decreased uptake is when there's less radiotracer accumulation than expected relative to the surrounding tissues, which makes the lesion relatively photopenic or hypometabolic, or essentially has decreased activity. Now here's an example of several areas that have increased activity or increased uptake, and this is seen in metastatic lung disease. Okay, and in this example here, there is essentially an area that has decreased uptake, which is relatively photopenic to the remaining tissue, and this is the perfusion, a portion of a ventilation perfusion scan of a lung that has a pulmonary embolus in the right middle lobe. So I hope that this has been a helpful review of the imaging modalities and their terminology. Please feel free to email me with any questions. Thank you.